as she started some of this movement that she was doing, I all of a sudden just felt this whole rush of fluid across my chest. It was like, wow. It just felt wonderful, and I was just thrilled with what you did, madam. Thank you so much. And so I'm just convinced that the least bit of swelling that we have is something that needs to be taken care of all the time.
Hello and welcome. My name is Sharon Gaston. I'm a medical massage therapist and I specialize in manual lymph drainage therapy. I began my career in 1994 as a massage therapist, joining the American Massage Therapy Association and becoming a member of national certification. I have maintained those since the very beginning. I have extensive educational background, including certifications in LLCC, which stands for Complete Complex Decongestive Physiotherapy, neuromuscular therapy, including cervical trauma and TMJ, and sports massage, and am a member of the National Sports Massage Therapy Team by AMTA. I've taught at 3 massage schools. I teach practical applications for minor injuries to massage therapists in their continuing education, and I have been a team member of a clinical research program for muscular dystrophy. I'd like to present a couple ideas on how my work differs from other therapists. First of all, when people hear the word massage, they naturally assume that it's going to be spa work. This is not my work. I'm a medical massage therapist. What I do is complementary healthcare to what the doctor does, as well as work and coordinate with physical therapists. Secondly, there are currently well-known manual lymph drainage therapy schools, first being the Vater technique. Emil Vater in the 1930s developed specific therapies to be used by massage practitioners. He was a Danish massage practitioner as well as a doctor of philosophy. I attended the Upledger Institute, and my courses on lymphatic training were designed by Dr. Bruno Chicley. Dr. Chicley is from France, and his therapy is to teach students how to identify specific rhythms, direction, depth, and quality of the lymph flow. Therefore, when a therapist is using his techniques, they are going with the direction of flow that the body wants rather than arbitrarily just checking a point from a chart. There are schools that certify lymph drainage therapists in as little as 18 hours. This is not what the LLCC program comprises. LLCC is 140 hours minimum with hands-on as well as specific written tests that must be completed, and the certification must be reviewed and extra courses taken every so many years. The intent of my therapy is to reduce or eliminate excess fluids caused by severe traumatic injuries or secondary lymphedema due to surgeries. Decrease pain by boosting pain inhibitors, boost the immune system as wastes are filtered through the lymph nodes, and reduce infection as well, and calm the nervous system and decrease spasms. When these things are accomplished, the healing is completed quicker. Medications can be reduced sooner, and the return to activities of daily living is hastened. Therefore, medical expenses can be reduced as well. Contraindications for this therapy: all malignant diseases, all acute inflammation with infections. Some examples are bacterial infections and deep vein thrombosis. Therapy sessions are limited for infants and the very old and people with cancer because we don't want to overwhelm the body. It's preferable to have shorter sessions more frequently than one long session. Hydration is extremely important in lymphatic care. The patient needs to be hydrated to minimize any risk of having side effects of detoxification. Therapy begins at the terminus point, which is normally the jugulosubclavian area on the left side. And other lymph nodes are stimulated that relate to the area that you are going to work on. The work is always proximal to distal and away from watersheds unless the therapist is creating alternate pathways depending upon what is needed. We clear congestion and edema before going on to the next area. Other things, measurements on extremities are taken before and after the therapy to validate the entire overall reduction of the fluids that have been removed, and specifically in what centimeter amounts. We want to be looking for any areas that might indicate that the area is becoming affected by inflammation. At the end of a session, the heat and redness and swelling and texture of an area that has been infected will be able to show dramatic results. The heat being reduced, the redness intensity being lessened, and the feel of the congestion from that area will be more fluid. Therapy begins at the terminus point on the left side. The work is always proximal to distal and away from watersheds unless creating alternative pathways has been determined, and clearing congestion and edema before moving to the next section. Other things that are done are measurements of an extremity before and after the therapy to validate the overall reduction in centimeters of particular areas from the lymphatic drainage therapy. Now I'd like to demonstrate how I approach different conditions. Okay, our first example is of a cancer patient. I'm assuming that the right breast has been removed and the person has had chemo or radiation, so there's lots of damaged area and possibly the removal of sentinel lymph node or many more thereof. So the first thing is to open up the lymph nodes of the jugulosubclavian on the left side, the terminus point, and then the right side. We will then normally work just on the right arm, but because the person has had so much damage, we're going to send the fluids to the left axilla. I want you to envision across the shoulder a line on both sides, as well as a line down the back of the arm and a line down the center. These are watershed areas and we normally don't cross them, but because of the damage this person has received, we'll cross those watersheds. Now, we've opened up the lymph nodes at the neck, and we'll open up the left and the right axial lymph nodes, and we proceed by stimulating the lymph in particular sections of the left side of the chest and send the fluids to the axilla. And as the area is decongested and the fluids feeling more water-like, not